Welcome back. As we enter into the cooler months and seasons, our skincare needs may change with the weather. It can be hard to know what new treatments you may want to implement, so we are talking with the expert today, Dr. Simran Sethi with RenewMD. Dr. Sethi, thank you so much for joining us today.
Thank you, Rachel.
Of course, it's always so good to have you, especially when the seasons change, because our skincare should change too, right?
That's completely correct. You know, there's opportunity to do some procedures and that are excellent for the fall and winter and can sort of clean your skin up from all the sun damage we get because we just have longer days in the summer. And even if you're not outside a lot or very active, you are still likely going to get some sun damage just because of warmer, more light. But I'll talk a little bit about procedures, facials, and what to look for in a facial, and then what we can do on a daily basis with our skincare.
Perfect. So how do we know if you just need something to do at home or if you need to go in and have a procedure done?
That's a good question. So I think if you find that you're seeing a lot of hyperpigmentation or dark spots, skincare is of course essential, but a lot of times you do need some extra effort, and there are some very, very safe procedures that can accomplish that. My favorite is PicoSure laser. It's my favorite because it's a very, very intense laser. However, it has zero downtime, and it is extremely safe for all skin tones, which is very, very important.
Yes, because if you have a darker skin tone, some things are not safe for you, right?
Exactly, exactly. They can, in fact, cause you to have more dark spots. So exactly.
Okay, and then if for someone who's never had facials before or anything like that, you do that stuff as well, right? And is it tailored person to person?
It is, it is. So, you know, when people think of facials, they think of a Mother's Day gift once a year and very luxurious, which they should be. But facials actually have a purpose. So when you get a facial, and we do, of course, in our office, medical grade facials, the goal is to get a very deep exfoliation. And chemical peels are an excellent consideration if you're, again, trying to sort of sweep off all the pigmentation that we get with sun exposure during the summer.
And the video that we're watching looks just so relaxing, Dr.
And yes, and they always are very relaxing. So that's always a plus with facials.
Yes, treat yourself a little bit as you change seasons. And then let's talk about what people can do. Maybe they've come in to see you, but they want to continue that. It's really important to continue that at home, right? The skincare?
Yes, exactly. So, you know, no matter whether you need procedures or not, skincare is always essential because it's what you're doing daily. It's what you're nourishing with your skin with on a daily basis, and also protecting your skin. And in California, our winters and actually our summers too are very, very dry. And if you are someone who has oily skin, for example, likely you are going to need something more moisturizing in the winter. So there will be a change in your skincare routine, and maybe you now have to add in a moisturizer. If you have dry skin, you're likely going to change your moisturizer to something that's more lipid rich. It has more fats in it, and that will help again, you know, fight all of that skin barrier damage that we get in the winter dry months. But something that a lot of people don't remember is sunscreen. Sunscreen is equally important in the winter as it is in the summer. And again, we are lucky. We have so much sunlight. And even if you're inside, you have your windows open, or if you're driving, your car still gives you a lot of sun exposure. So
wow, so still sunscreen, even inside.
Sunscreen is still important inside, yes.
Okay, wonderful. I want to talk about some of the products we have from your beautiful line on the table. What have we got here today?
So, you know, I put here 3 things that I think are essential things to think about when you're transitioning to winter or fall skincare. The first one is a hyaluronic acid. And hyaluronic acid is something that a lot of people apply as soon as they wash their face, but it's actually a product you apply to seal your moisturizer.
Okay.
So you apply it last. So that's why I put it over there, because it's actually in all my product sets, and it's important for whether you have dry skin, oily skin, mature skin. So, but you have to apply it on top of your moisturizer.
Oh, I didn't know that. You just taught me something. I always did it under, and that's good to know. Okay, what else have we got here?
So then I have sunblock, and now sunblock, of course, we talked about how it's important, but also it has to be a complete sunblock. So this sunblock also has blue light protection, which is something that causes damage not only to collagen in our skin, but also the fat that helps keep our skin lifted. So to have a comprehensive sunscreen, you do need blue light protection, which ours does also.
Okay, good to know. And the final product we have here?
So this is actually one of my, in my line, is probably one of our most popular products. Ooh. It's our vitamin E and F serum. So the E is vitamin E, which is an antioxidant, and the F actually stands for fats. And it's a very, very nice, lipid-rich, luxurious serum, but it doesn't leave your skin greasy, which is why so many people like it. So an excellent choice for winter skin, especially if you have dry skin.
Okay, fabulous. These are wonderful, Dr. Sethi. Thank you so much for the advice as we transfer seasons into winter and fall. All right, to learn more, you can head to RenewMDWellness.com. And Jess is joining us now with what we have next.